testing and linkage to care. This training module is intended for individuals providing HIV testing services in facilities and in communities in resource-limited settings. This module has been developed to support the Fast Track Cities initiative. The Fast Track Cities initiative is a worldwide movement that seeks to use the unique potential of local communities to accelerate progress towards achieving HIV epidemic control. More than 250 cities worldwide have joined the Fast Track Cities initiative. The primary partners in the Fast Track Cities initiative are UNAIDS, the International Association of Providers of AIDS Care, or IAPAC, and UN Habitat. The goals of the Fast Track Cities initiative are to optimise the HIV care and prevention continua towards the attainment of the global 90-90-90 targets, to increase the utilisation of combination HIV prevention services, to operationalise global and local treatment policies at the city level, to reduce to zero the negative impact of stigma and discrimination, and to establish a common web-based platform for real-time monitoring of progress. The purpose of this module is to summarise recommendations made by the World Health Organization for HIV testing and linkage to care. After completing this module, you will be able to explain the importance of early diagnosis of HIV and linkage to care as key steps to improve the health and well-being of people living with HIV and reduce the number of new infections. HIV testing, and also look at WHO recommendations for HIV testing. We now have the tools needed to end the AIDS epidemic. This module offers information and guidance on attaining the first two 90-90-90 targets that UNAIDS has set to achieve by 2020. Those goals are ensuring that at least 90% of all people living with HIV are aware of their HIV status, and linking at least 90% of all those people diagnosed to treatment services, to HIV testing, and experience lower rates of HIV diagnosis. Men, for example, are less likely to know their HIV status than women. In Western Central Africa, 58% of women living with HIV know their status, but only 38% of men know their status. An approach that simplifies and adapts HIV services across the cascade of care to reflect the needs of various groups of people living with HIV while reducing unnecessary burdens on the health system. In the context of HIV testing, differentiated care aims to develop HIV testing strategies to identify those people living with HIV who do not yet know their status and either link them to HIV care if they test positive or to prevention services if they test negative. We will now take a moment to examine differentiated testing framework developed by the International AIDS Society and partners. HIV testing service delivery model, mobilising, testing, and linkage to both prevention and treatment. Mobilising HIV testing services may occur through mass community-based campaigns, through networks of people living with HIV, or at the level of individual notification and index testing. HIV testing should be integrated into all clinical settings, but supplemented by robust community-based testing. In particular, community-based testing and counselling for key populations linked to prevention and care treatment services is recommended by WHO, in addition to provider-initiated testing and counselling. Self-testing can be used within facilities, non-health facilities, or in the community. We will discuss HIV self-testing in more detail later in this module. It complements and creates demand for existing testing services. It is private, convenient, and an empowering way to test, either alone or with a trusted person. HIV positive diagnosis. All reactive tests must be followed by further HIV testing by a trained provider, starting with the first test in the validated national testing algorithm. WHO recommends that all those who test positive should be initiated on treatment within 7 days. Exposure to HIV within the preceding 12 weeks may be in the window period and may have a non-reactive self-test result. The window period is the time between potential exposure and when the test will give an accurate result. During the window period, a person can be infected with HIV and be infectious, but still test HIV negative. They should have a repeat self-test in 14 days or seek HIV testing in a facility or a community testing place. Diagnosis and the role of point-of-care diagnostic testing. Reliance on centralized laboratories for early infant diagnosis, or EID, is inadequate. Specimen transport, laboratory backlogs, and difficulties in reaching mother-infant pairs with results cause extensive delays and loss to follow-up. Up to half of HIV-exposed children never receive test results when tested through traditional EID. Point-of-care EID reduces turnaround time and accelerates initiation of antiretroviral therapy. Multiple EID products are available and pre-qualified by WHO, which recommends the use of point-of-care EID for the diagnosis of HIV in newborns. Point-of-care EID reduces the time from sample collection to receipt of results from 56 days to less than 1 day. The proportion of HIV-positive infants initiating antiretroviral therapy within 60 days of sampling was 90% for point-of-care EID compared to 13% for traditional EID. Testing emphasizes the need to expand testing services beyond health facilities. A number of strategies exist to move testing services closer to the communities that need them and to make learning one's status easier and more convenient. We will now explore 3 different strategies for testing delivery: multi-disease testing, home testing, and partner notification. Testing as a single intervention, multi-disease approaches nest HIV testing as one of many health conditions for which people are screened, including hypertension, diabetes, malaria, cervical cancer, and tuberculosis. Multi-disease screening can achieve very high levels of knowledge of HIV status. This approach has been successfully used in diverse settings to achieve rapid increases in knowledge of HIV status. In Cape Town, the mobile Tutu tester is an initiative of the Desmond Tutu HIV Foundation and travels to high-burden parts of the city to deliver screening for HIV, hypertension, tuberculosis, and the need for family planning. The SEARCH trial in 32 rural communities in Uganda and Kenya evaluated a multi-disease hybrid intervention that included 2-week health fairs and provided screening for HIV, hypertension, diabetes, cervical cancer, and family planning, and follow-up home-based screening for people who did not attend the fair. The approach achieved population level of HIV status exceeding 90%, achieving high levels of knowledge of HIV status. Home-based testing is especially effective in reaching children and people who have never been tested. Home-based testing is less effective in reaching men and adolescents. In the POP-ART trial in Zambia, home-based testing achieved very high levels of knowledge of status among women, greater than 90%, and lower levels among men. Strategies be integrated into HIV testing and treatment programs. Partner notification can focus solely on the sexual or drug-using partners named by individuals who test positive. In high-prevalence settings, index testing involves the routine offer of HIV testing to all members of the household, of a person who has tested positive. There are several possible approaches to partner notification. In assisted partner notification, trained healthcare workers contact partners or household members to provide counselling and testing. For passive partner notification, healthcare workers advise an individual who has tested positive to inform his or her sexual or drug-using partners. Contract notification involves an agreement between the health provider and the person who has tested positive that the client will inform his or her partners. In contract notification, the client receives training on how to disclose his or her status. Significantly increase HIV testing among the partners of people who test positive and facilitate linkage to care. Assisted partner notification is more effective than passive partner notification in increasing testing uptake among partners of people who test HIV positive. All forms of partner notification must be voluntary, and only trained healthcare workers should undertake partner notification. No involvement of law enforcement is appropriate. Social harms associated with partner notification, such as intimate partner violence, have proven to be rare and can be minimized by careful attention to social and legal environments. HIV testing and ways to overcome them. Let's look at barriers and strategies for linking people who have been diagnosed with HIV to care. 59% of people living with HIV were linked to care and on ART. WHO recommends that newly diagnosed people living with HIV should be linked to care and initiated on ART within 7 days. Priority initiation, including same-day initiation, is recommended if the person is ready to start. Systemic, client-based and provider-based. Systemic barriers relate to accessibility and availability. For example, a person who lives in a remote area may have to travel long distances to receive HIV treatment with providers. For example, clinics may have no systems in place to follow up if a person fails to keep an appointment. Clinics may also not have functioning links with community testing programs. And stigma and discrimination within healthcare settings remains a significant barrier to people accessing services. Or internalized stigma, which can create a disincentive for people to seek medical services. Moreover, a person who is not fully educated or counselled may not understand the importance of immediately seeking medical services. Other client-based barriers may relate to the setting, acceptability of the provider, confidentiality, or trust. Practices for linkage to care. These are home-based HIV testing and home-based ART initiation, decentralizing ART services in differentiated models of care, communication technologies such as SMS reminders, integrated services, peer navigators, assistance with transport, and community outreach to find people who are lost to follow-up. This module, and take a few minutes to ask the following questions. Why do 1 in 4 people living with HIV globally not know their HIV status? What are the barriers to HIV testing? How can differentiated HIV testing services increase knowledge of status? These can be used. What are the 3 main barriers to swiftly linking people to care? What are the evidence-based interventions that can improve timely linkage to care?